welcome to another COVID-19 update for Saturday, August 22, 2020. Today we are sitting with the Honorable Minister of Health, Dr. Frank Anthony, and he will be sharing with us some updates with regards to what the Ministry of Health is doing in response to COVID-19 and what else we can expect as the days go by. Minister Anthony, thank you for joining us.
Thank you very much for having me here on your program.
Great. So we are going to get the ball rolling right away. And I just want to ask you, Minister, it has been 3 weeks since you took office at the Ministry of Health, and your primary focus has been generally to revamp the COVID-19 national response. Please update us on that process and also share with us some of what we can expect.
Well, we started by looking at the organization of how to respond to COVID. And you would have known by now that we have reorganized the response. So from the task force level to the Ministry of Health response to other sectorial ministries, how they are responding. In terms of the task force itself, at the top we have Ministry of Health, we have the Prime Minister chairing that committee, and we also have UN, and we have the PAHO, and we have CARICOM involved in that. So it's a blend of local and international partners. So because we believe that the experiences of our international partners, we can bring that to bear in what we are doing here in Guyana. So that's why we thought it's important to have them at the highest level. In addition to that, below that level, we also have the action committee, so to speak, the people who are coordinating, who are doing all the different things that we need in this response. And so that is housed, that secretariat is housed in my ministry. And we have been working very hard with not only governmental agencies, but a number of private sector agencies as well. So I think the response that we have, or the mechanisms that we have organized now are very, very responsive. And we have seen over the last weeks an improvement in how quick we are able to respond to various aspects of things related to COVID.
Okay, great. As we are about to talk about testing, Minister, I just want you to say publicly on camera, we know you've already sent out a statement, but we talk about the rumors of the contaminated test kits. Tell us a little bit about that.
Well, I think those things are very ill-founded. First of all, we have a well-trained staff. The way that we do the testing, the machines that we have, the ones that we're using have been in use for many years now. And we have also been procuring test kits. And that procurement is done by PAHO WHO. So they're able to bring those test kits in for us. It requires it to meet the WHO standard, and that's what we have been using. So I think one of the things that you know globally that the WHO itself has spoken about is that in this pandemic, there are persons who have been maliciously spreading rumors and false information. And that itself is a distraction in how we respond. So we have to be very careful that that is not taking us away from doing the right thing. And in this instance, it is so malicious in a way because it will, if people believe it, it would cause them to lose confidence in the National Reference Lab, our ability to test, and question the kinds of results that are generated by our labs. And that can undermine the way that we respond and also the public's behavior. So this is a very serious matter, and that's why we have promptly responded when we saw that circulating on social media. So I want people to understand that the way that we have been doing testing is in accordance with international protocols, and the material that we have been using meet the international standard. And as I said before, PAHO WHO has been the ones who have been procuring the test kits for us, so we have met all the international standards.
Okay, great. So, on the note of testing, as we continue along that line, Minister, we know that medical technologists have been trained and you're looking to even further expand the testing capacity by having them work 3 shifts and other than. What else can you tell us in terms of the Ministry of Health expanding testing capacity for COVID?
Well, a couple of things. The testing that we are doing is using PCR, so that's a diagnostic test. We want to expand that capacity at the National Reference Lab, and we're looking at another site outside of the reference lab where we can have another facility. But at the National Reference Lab, as you rightly said, we have, with the use of the current machine, we are trying to get them to do more with the current machine. And that is why we have introduced the 3 shifts. Instead of doing maybe about 60 to 80 tests per day, we are now able to do 3 times that amount. So that's because of the shift. They're taking turns in doing this. So that's one aspect. But that's just the immediate, because we are trying to get automated machines into the National Reference Lab, because from the time a sample gets to the lab to the time that it actually processed, it takes about 9 hours. And that's when the sample actually come in and we start processing it, right? So we want to cut that time down significantly. And one way we think that we will be able to do that is if we have an automated PCR machine. Because what we are doing now is very mechanical, it's manual, so we want to automate that. We have since ordered one such automated machine, and we believe that it's going to cut the processing time from 9 hours to about 2 hours max. And we'll have the capacity of doing 96 tests within 2 hours. And if we run that several shifts, then we can actually do maybe about 500 to 800 tests in a day. So we are looking at how we can improve. We have placed that order. We're trying to negotiate how fast we can get it into Guyana. So as soon as we get that into Guyana, it would make a big difference. In addition to that, because these machines are not something you just put on a cupboard and it would, you can use it. There are certain conditions that you have to ensure that is there. So for example, because we're dealing with infectious material, we have to make sure that the conditions in which we handle these infectious material, that it does not contaminate the people who are handling it. So to protect the persons who would be using the samples or moving the samples, they have to do this in what is called a biohazard cabinet. Those cabinets, we have to install them. We have to get special people to come and inspect them, to certify them. So we are in the process of doing some of those things so that when we get the machine would go, so we'll have the whole suite that is ready. So a lot of these things are not things that happen overnight. They take a little bit of time to have all the pieces line up. And so I know some people are anxious to see us do more, but given the circumstances and in the short frame in which we've been operating, we have been trying our best, but some of the parameters are really beyond what we can do. But hopefully we'll scale up the testing, because that's what we're aiming to do. And that's only on the public health reference lab side, or the public sector side. We have been encouraging the private sector to also acquire a PCR machine. There was one time when the private sector had difficulty getting government's permission to do PCR testing. We have freed that up so they don't have to come to us to get permission to bring in a PCR machine, because we believe that all these private labs should have that capacity to be able to do testing. And so we have been encouraging them. And I've had some discussion with some of these private sector laboratories, and I know that they're in the process of procuring a similar automated machine that probably in some cases can do maybe up to 500 tests per hour and so forth. So I think between both the public and private sector, we will have enough capacity to do the testing that is necessary. So that's PCR testing. We are also exploring the possibility of having what is called point-of-care testing. So these machines look at trying to find the virus, the antigen. They might not be as sensitive, but they're very quick. So within 15 to 20 minutes, you can get back a result. And that is something that we are also exploring. We're talking to our medical team to see if we bring these types in, how can we use it, where can we put it, and how, what protocols we need to put in place for its use. So that's another option that we're exploring. We also have, and a lot of people have been asking us for the use of antibody testing. Now, antibody testing, there is a role for it, but it cannot be used as a diagnostic test. I see there's sometimes some confusion with people. They come and they do the PCR test, which is a diagnostic test, and then they maybe go in some place and they get an antibody test done, and that might be negative. And then they feel, well, maybe something is wrong. The PCR test is diagnostic, meaning that it would find the virus. And that would happen earlier on in the infection, right? So for the antibody test to work, it means you have to be infected. Your immune system would have had to react to this virus to produce antibodies, which takes some time. And then you would see the antibodies go up in your body. And when you do the test, then you might be positive, right? So it responds. So there's a lag. So these PCR tests would catch it very early, something that the antibody tests are not able to do. And so that's something that people have to understand, that if they come and do a PCR and then they try to double check it with the antibody test, it's not going to work. And I've seen maybe there are a few people who don't understand the science, and they have been doing that. And again, maybe unwittingly, they have been posting the wrong things. So I hope that would clarify the thing. So it's better to do the PCR if you want to know if you have the virus.
And for clarity, the antibody test is the rapid test that
Yes, we can say it's a rapid test, but you also have these rapid tests that detects the virus itself, the ones that I was telling you about, which is sometimes termed as a point-of-care test.
Yes. So, Minister, with much testing happening, we are also seeing that there are a lot of positive cases, and something must be in place to treat these positive cases. Can you tell us a little bit about treatment for COVID?
Well, maybe before we go to the thing with treatment, I know a lot of people have expressed some worry because they're now seeing all these numbers going up. And indeed, it is going to go up more, because as we increase the amounts of tests that we are doing, we are going to see more positives, right? In the past, testing was very restricted. There was very strict criteria on when you will do the test, and therefore, if the test was only available after you get symptoms, you know, there's almost, you'll have a clinical picture that this person is presenting with COVID, and then you do the test, so you know you'll probably get a positive here. But when we look at what is happening in other parts of the world, there are lots of people who would be asymptomatic, meaning they have no signs or symptoms of this disease, walking around feeling, you know, pretty normal, but they're carrying the disease because they're infected. And if you test them, they will be positive, right? They themselves are unaware that they have the disease because they have no signs or symptoms. And then you have another group of people that would have very mild signs and symptoms, meaning they might have a little cough, might have a slight fever, some people might have a little muscle ache, and they might say, oh, I'm getting the flu, right? So very mild, and then a couple days after, it goes away. But they probably had a manifestation of COVID-19, and they didn't realize it. So if you test those persons, they're also going to be positive. Now, in the early days of this epidemic in Guyana, you know, from the 11th of March onwards, we have pretty much restricted testing to only people who are, one, symptomatic, right? And therefore, because we had very limited test kits in the country, right? So we were picking and choosing, cherry picking, so to speak, who would get the test, who would not get the test, and so forth. And that is why in the early days of the epidemic, we had just a few cases. Now we have opened up the testing, right? We are collecting a lot of samples in Region 9 and all the regions. So we're taking samples from all regions. They're coming in now to the lab. In Region 4, we actually have sites that are set up to do testing. So we have a site in Herstelling. People can come there to get a test. We have a site in Georgetown. We have a site in Paradise, right? So people know these places, so if they have, or they think they have been exposed, they can come. And one of the things that we're now picking up is a lot of people who are asymptomatic somehow feel that they're at risk. They come to get tests, and then we're seeing that they're positive. This was not happening before, and I don't want people to be alarmed, but we are going to see more positives as the day goes by. Now, we need to prepare because a percentage of the persons who tested positive would require hospitalization, and a percentage of those persons who are hospitalized would then need ICU care. And so we're making all preparations to ensure that all persons who would need hospitalization, that we can have our hospitals ready to provide that type of care. One of the things that we did last week was to standardize our treatment protocol for COVID-19 patients because we had a technical clinical working group, and these comprise of doctors from the Georgetown hospitals and other hospitals, and they were able to put together what would be our national treatment protocol for COVID-19. This week we'll be rolling out a training for doctors, and the Medical Council would be accrediting those doctors who participate in that training. The training would be virtual. So that is happening, but also we are now evaluating the hospitals, like the various regional hospitals, to see what we need to improve, how we need to create a special COVID-19 section, because you want people, if they're positive, to be kept away from the other hospital population so there isn't cross-contamination or hospital infections. So we are trying to make sure that we make adequate provisions for that, and also that we create small ICU spaces to take care of those patients who are hospitalized and who might have respiratory distress. Now, one of our big challenges is that even at the Georgetown Hospital, all that we were hearing we only have about 4 working ventilators in that infectious disease ICU. So this is another area over the last 2 weeks or so that we have spent a lot of focus on. How do we get them the equipment that they need? And so we are very grateful to the Indian government who has provided us with funding, and we have purchased, among other things, with that funding, 29 ventilators. The first batch of those ventilators would come in, we are hoping next week. And as soon as they come, the team from the Georgetown Hospital, that's one of the first hospitals that we'll want to send these ventilators to, because they're seeing, very sick patients, and they would really need this type of support. In addition to that, we'll send out ventilators to the regional hospitals so that they too can have an area where they can provide some level of ICU care if it is required. And we will do the relevant training with those doctors to make sure they understand how to use and when to use and what are the protocols and so forth. Now, when I was reviewing some of the things that were bought by the ministry, I noticed that we had bought 2 ventilators from somebody, and one was sent to Region 1 and one was sent to Region 9. This was done some time ago. I don't think we have paid as yet. But those ventilators are not working. And apparently there are parts that are missing. So while this is supposed to help with providing some level of support to these regions, if parts are missing and you cannot use it, then it's of no benefit to the patient. And so that's a challenge that we have, and we'll be examining that. But we are going. The idea here is that we are going to make sure whatever we need to do at the hospital level, that we expand that and we equip the place so that person who need that type of care would be able to get that type of care. At the Georgetown Hospital, they have a challenge in a sense, because they have seen a lot of patients coming to them. And one of the precautionary things that they will do at the hospital is screen people for COVID-19 before they go to other sections of the hospital. So if we are not fast with our turnaround time with laboratory results, we can easily have a backup. So one of the things that we are examining now is how to decant some of these patients, how to put them in other environments. And that is why we are trying to activate the Ocean View Hospital. We want to, first of all, start it by doing an isolation center, so people who are positive but presenting with mild symptoms, that we can put them there, have a staff there, and maybe look at about 55 beds. So if we are able to do that, then it would free up some space at the Georgetown Hospital, and where we only focus on the sicker patients who would be there and they need ICU care. Because as I reported before, the facility at Ocean View, we are not able to put in the ICU as yet, and there are lots of other works that would have to be done. But we think, and the medical team that went in to make the assessment there, think that we can get 55 beds up and running, just for the milder cases. If they develop some complications, well, then we'll have to move them from Ocean View to the Georgetown Hospital. So that's something that we're working on in terms of capacity. So we're building central capacity here at the Georgetown Hospital, but we are also expanding and looking at regional capacity. So at least if there are any cases in the region, that we will be able to take care of that as well.
Okay, Minister, I took note of when you were pointing out the areas in Region 4 where persons could go get tested. Regions 5 and 6 have reported they've been said to be COVID-free until, you start
Right.
mass testing and you found cases. Is there a place or places in these regions set up for people to just go and say, well, listen, I need to
Well,
have a test?
well, so far it would be at the hospitals. We have equipped them with the kits so they can take the samples there. But later on, we would look at other options and also to provide maybe mobile units that can go into particular community and do the testing. At one time, I think too, people were afraid of getting tested. And I think we have gone beyond that now, and people are coming forward and taking the test. So that's another factor because a lot of people had fears that if they get tested and they're positive, you know, we'll come and pick them up and lock them up and that sort of thing. I think that fear has eased somewhat, and therefore we are seeing much more people coming out to get tested. Just to give you an example, yesterday we had 400 and I think 50 something samples that were collected. You know, so that's quite a lot of people coming forward to be tested. Now, some of them would be sick patients, but a lot of the samples there were collected from people who just um, came forward to be tested. So I think the stigma that was once attached to the disease has eased down a little bit, and people are coming forward. So that's another way that we'll find a lot of asymptomatic persons who would be positive.
Okay. So while we have new cases coming out every day, we want people to know that they can prevent becoming infected with COVID-19. It's just some simple guidelines you need to follow. Tell us a little bit about the ministry's risk communication angle. How are they going about doing that?
Well, you know, this whole thing with getting infected really stems with how the person behaves, right? And as you rightly said, there are a couple simple steps that you can prevent, how you can prevent infection. Now, first of all, if there's an infected person and that person coughs, then the droplets that come out from that cough can travel up to 6 feet, right? Now, if you're not wearing a mask, if that person is not wearing a mask and you are not wearing a mask, then those droplets can get to you, especially if you're in close proximity. Now, it's not only about coughing. If you are speaking to someone and you are infected and that other person is not infected, but you don't have on any mask or something to protect you, then again, when you speak, they are aerosolized droplets. Maybe we can't see them. That would, you know, come out and it can infect the other person. So there are two things there. One, they're droplets, and two, they're aerosols. The virus would be in smaller particles, and those can travel even beyond 6 feet. So when you wear the mask, what happens if there's an infected person and that person is wearing the mask and they talk, a lot of those viral particles are trapped in the mask. So it reduces the viral particle coming out to infect you, right? And then if the other person that you are talking to wear a mask, then at the beginning, this person who's infected has reduced shedding of the virus, and therefore you are also protecting yourself, and the risk then is drastically reduced. But when you don't wear a mask, you're putting yourself at risk. And again, because we don't know who's carrying the virus or who is not, it is better that you protect yourself, you know, every time you're in the public domain. Now, the orders that was passed, and I don't think a lot of people realize this, the orders that were passed make it mandatory for anyone who is in the public space If you're outside or you go into a public building, you have to wear a mask. It's the law, right? But people have not been abiding by that law. And so one of the things that we'll be doing more of, we'll be doing an enforcement of that law. And in the law, it provides for punishment. So you can be fined and you can go to prison. Now, we don't want to lock up people for not wearing a mask, so we want to appeal to persons, do the right thing, because this is going to protect you and it's going to protect your family. So mask wearing is an important thing, and we have to keep emphasizing that. And I hope that by understanding how this disease is transmitted, that people start paying more attention to wearing a mask. So the thing is that we want people to wear their mask, and I think we need to have everybody taking action, because if everybody start talking to their friend or their family and say, listen, when you go out, please wear your mask, and we start being each other's keeper in that way. I think the attitudes that we've seen now is going to change. So mask wearing is an absolute necessity if we are going to reduce the spread of this disease. The second thing is that when somebody sneezes or coughs, and if they're infected, the droplets can fall on surfaces. And if they fall on surfaces, they can survive for a protracted period. And there was a study that was done showing that on different surfaces, these viruses got different periods of time that they can stay on these surfaces. Now, again, we don't know who would have walked by here or touched this door handle or do something. So one way of protecting yourself against that is that you have to sanitize your hands. And it's a simple thing. Now, if you don't have the money to go buy a fancy hand sanitizer, you can do so with soap and water. Just wash your hand with soap and water for 20 seconds, and you're good, right? And that's not so hard to do. So again, we want to appeal to people to wash their hands. And then the third thing, again, going back to the infection and how it spreads, droplets generally do not travel for more than 6 feet. So if you keep your distance and you are with somebody who is infected and you don't know, but you're keeping your distance, then if they cough or they're talking, those droplets would be harder to get to you. And hence the thing about keeping your social distance or keeping your distance at least 6 feet, right? Now, in some situations, it might be difficult to do that, but if you're wearing your mask, then maybe you can reduce the distancing. But people ought to take these precautions, right? And it's going to, if everybody take those precautions, then all of us as a society would be protected. But if people are not taking these precautions, then some of us are going to get sick, and we potentially can spread it to others. And we don't want that. I think everybody wants the cases to come down, but the cases would not come down if we don't play our part. We are all in this together. This is a national effort. It takes the whole of Guyana to make sure that those cases come down. We can offer the guidance. We can put the infrastructure in place. We can talk about these things and so forth. But what we need is participation. We need people to heed the advice and do the right thing. And I think once we start getting that, we will see we'll make a difference. And that, we have to get everybody involved in doing that.
Minister, our time is gone, and we know that there is a lot more happening than what you have shared with us here. But is there anything that you would like to just leave with the public in closing?
I want to assure the public that we at the Ministry of Health and the government as a whole, we have taken COVID-19 very seriously. President has prioritized this. Right away, he has allocated $4.5 billion to help with the response. And we have worked with several multilateral and bilateral partners to also mobilize additional resources.
Yes.
So we are working at that level to ensure that we have adequate resources to respond to this pandemic here in Guyana. We need PPEs to protect our frontline workers. We are ensuring that we can get those PPEs in. Medicines for patients, we're working on that. We have in the system, but we're working to get in more. There's specific medication that the doctors would normally use in terms of COVID-19. So far, those have been out of the reach of our local doctors, and we are trying to source some of that so that we can have it in Guyana for very critically ill patients. We have started engaging with a number of global players in terms of the vaccine.
Yeah.
You would know that there's a global facility called COVAX, where it's an investment vehicle where they're looking at 13 vaccines and they'll be investing in them. And if Guyana is eligible to be part of that, and we are going to be part of that facility, and once a viable vaccine becomes available globally, we will get enough doses to immunize or to vaccinate 25% of our population. We have also engaged with India to look at the possibility of the vaccine that is being developed by the Serum Institute of India. And we have also been speaking to the Russians to look at the vaccines that the Russians have been developing.
Mm-hmm.
So once we can, once a vaccine is available, we want to be one of the countries that can benefit from that, because we feel that a way that we can exit COVID-19, so to speak, is we will have to get a vaccine to protect our population against this virus. And without a vaccine, it's going to be very difficult to exit this situation. So that is why we have been looking at all the global players, talking to them, engaging them, to ensure that once a viable vaccine is available, that we can source that vaccine for our citizens. So we are doing a lot of things. Every day we are engaged with this, and we are really looking at how we can improve what we are doing, making sure that we have the meds, making sure that we increase the awareness, and trying to build teams of people that can help us to reach out to the population and just get that message across. But I think the most important thing here is people's involvement. Because if everybody take on their own responsibility of being safe, then all of us would be safe. And so I can't emphasize that enough, because that really is the key for us until we can get access to a vaccine.
Well, thank you very much for that, Minister Anthony, and thank you, viewers, for listening to today's COVID-19 update. We were talking with the Honorable Minister of Health, Dr. Frank Anthony, and I do encourage you to stay connected to the Ministry of Health and DPI's social media platforms to get more updates on COVID-19. Take care, Guyana.